Good morning, everyone. Welcome to our briefing this morning. It is Wednesday morning, March 16th, and we are 1 year after we've had the stay-at-home orders issued by Governor Cooper. And we are here today with our members from Catapult Employers Association. This is the combination of CAI and TEA. We have come together as of the beginning of this year to form an employer association supporting companies throughout the state of North Carolina. We are here as well with additional folks who have joined us from the community at large. We are very appreciative of your time and attention this morning. Our goal today is to be able to give an update and bring in some experts for you to really give an understanding of where are we, what's happening at the national and the federal level. So we have Andy Slavitt here from the President's Coronavirus Response Team here to speak with us. And then we're going to have an employer panel to give us a sense of what's actually happening and how have employers responded in the midst of the pandemic. And then we'll take a break and we'll finish out our session with Dr. Mandy Cohen, who will talk with us from about 11:30 to 12. So that's our agenda for today. I am very grateful to have all of you here. I encourage you to put your questions in the chat box and we will take them at the conclusion of Andy's comments. And we'll do the same thing as we work through the employer panel and then as well for Dr. Cohen's comments. Again, I welcome you on behalf of Catapult. My name is Molly and I will be your moderator this morning. Andy is having some challenges with the video camera that we can't quite figure out. So we are going to go with an audio and we will in fact now turn it over to Andy. So Andy Slavitt, welcome, and you have the floor.
Thank you, Molly. Molly, can you hear me okay?
I can hear you fine. I can hear you fine. And we've got now a picture up so everybody can see Andy. And so Andy, I'm going off camera, but I will be right here behind you.
Yeah, so you don't even need to look at me. You just look at my static face.
That's right. I maybe wish you were smiling a little bit more with some good news for us.
That's
what do you
me
have
smiling.
To tell us about?
That's me smiling, believe me. I'm doing my best. Well, welcome everybody, and thank you for having me. As Molly said, it has been quite a year. I wish I could report to you that we're through with this pandemic. But I can at least say that we are very possibly in the home stretch if we all work together. I want to start by acknowledging the toll that this has taken on everybody in terms of lives, in terms of our health, in terms of our livelihoods, in terms of disruption, in terms of our ability to see the people we care about, in terms of impacting the businesses that we've built. And it's something that none of us really anticipated. Yet through it all, I think the public will show that we can get through this, that we can face down this challenge, and that we can eventually emerge and emerge in hopefully many ways stronger or at least wiser from what we've been through. There are a lot of threads that have run through this pandemic, including the fact that in a really impressive turn, science has really taken hold to provide us a way out in a time that is probably shorter than we otherwise could have imagined. And while it seems like we've been at this for a long time, we should be, I think, quite proud of our scientists and consider ourselves quite fortunate that we have 3 vaccines today that are highly effective and really can make a difference to bring this thing to an end. Let me start by telling you a little bit about the president's agenda. President Biden is focused on bringing support to the country to get us through this crisis by doing a few things: leveling with the public, executing and taking accountability to deliver on the things necessary to move the country together, pledging to unite the country and make sure everybody's included, all voices, all people, and just essentially trying to put aside some of the squabbles of the past year that don't do us any good and have hurt us on the way there to get the road back. And he is, in my interactions with him, deadly serious, deadly focused, and I would think it's safe to say that none of us in the White House will get a good night's sleep until we get to the other side of this and do everything we possibly can. And it really has been an execution mission. We have been in here since January 20th, working very hard to try to make a difference. And I'm pleased to say we're gaining on it, but not there yet. So the road back includes at least 6 core elements. Number one is a massive acceleration of vaccine distribution in the country. Number two is the prevalence of testing, particularly rapid at-home testing. Number three is being able to open up our schools safely. Number four is being able to open up our businesses safely. Number five is onshoring production and manufacturing and using the Defense Production Act and other tools to get the resources and capabilities that we need to not only accelerate the fight against the pandemic, but also to make sure that we are not dependent on foreign production and don't have the stock, and to make sure we have the stockpiles that we need. And 6, resume global leadership. We will not defeat this pandemic in the U.S. alone. We intend to defeat it in the U.S. as our primary objective, but that is necessary but not sufficient. We have to resume a role in global leadership, and we've begun to do that by helping to contribute resources to vaccinate the rest of the world. To put it plainly and simply, we have committed to get 100 million shots in 100 days and 100 million checks out to the public to support the public through this from the American Rescue Plan, which also supports businesses, schools, state and local municipalities, vaccination efforts, children. So it's an incredibly important piece of legislation. And it really is symbolic of the fact of something that I think is the theme of my comments this morning, which is that we all need to pull through this together. That this is not an effort of government alone. In fact, it's not primarily an effort of government. It's an effort of government, states, people, doctors, physicians, businesses, scientists. And if we don't all do our part, we lengthen the crisis. If we all do our part, we think we can get there more quickly. But we set out this goal to do 100 million shots in 100 days. And we believe now that we will hit 100 million shots on or before day 60. So we've seen an acceleration. Let me tell you where we stand. We have about tripled the number of vaccinations that occur every day. We've done that by significantly scaling up production. We've done that by significantly increasing the number of places people can get vaccinated, in more retail pharmacies, in large community vaccination centers, funding them, and by increasing the number of people that are actually doing vaccinations by the thousands, including bringing retired doctors, nurses, dentists, and others off the bench in a really kind of all-of-country effort. Today, 2/3 of seniors have received their first shot of the vaccination process. That is compared to about 8% when we got here January 20th. So we've seen exceedingly good progress in taking care of our seniors. That's important because 80% of the deaths from COVID-19 are to people over 65. We have set a couple of markers. May 1st, that every state should be opening its eligibility for vaccinations to all Americans. By May 31st, we will have enough vaccines for every adult. And the president has laid a marker that if we all do this together, by the 4th of July, we should be in a position where we are able to safely congregate again and begin to get back to things that are important to us. But importantly, along the way, we are able to take some important steps, such as being able to reunite grandchildren and grandparents without masks. And I think we'll see different sort of steps down the road if things continue to go well. There are challenges. I think one of the things that I'd be less than honest if I didn't say that along this path, we've seen this virus has surprised us over and over again. So it is not entirely predictable, and it would not be wise for us, even with a path to get to a better place, to predict the future. If people drop their guards too quickly, if people stop wearing masks, which are really proven to be effective against spreading the virus, if people don't take the vaccine in large enough numbers, all of those things are sources of concern. So we are focused, as much as we are on increasing the supply of vaccines, is to making sure we are communicating well with people so that they feel comfortable taking the vaccines. Finally, before I stop and take some questions from Molly, I would say that all of our country's businesses play an important role here, and we have been reaching out, asking businesses to take on that role. There are three things that I think we are asking of businesses as we try to move together to open safely. The first is to pledge to maintain and create a safe workplace by promoting and enforcing mask wearing to employees, to customers, to people on the premises, until such point as we get past this, which is not forever. It's probably in the course of the next couple of months. So we're asking businesses to make that pledge. That's important because the government shouldn't be the only voice talking about things like mask wearing. In fact, for many people, the government is not a voice that they necessarily want to hear from, but they do respect you, their employers, they respect their peers, their employees, they respond to the social pressures of others telling them why this is important and why this matters. And of course, all of us have employees that have people in their households with medical conditions or who are elderly. So it's important that we do that. That's the first part of the pledge. The second is that we encourage your employees to get vaccinated when it's their turn, in particular by removing any barriers that might exist. Many companies are choosing to give their employees paid time off for either the day after their second shot or some other form of incentive as appropriate. We think that's encouraging. And then third is to help promote the important messages through all of the people that in the community that you're in contact with. And that's through whether you have websites, physical premises, products. We're seeing companies that are doing that, and companies around the country, big and small, are going above and beyond and being part of this. I think part of this national solution. So we can forward over to Molly. We can get to you kind of a copy of what this pledge looks like, and we've got thousands and thousands of businesses across the country that are signing it and are leading the way. And all of those things are bringing people more comfortable, employees, customers, and others, that we're on our way back. So with that, I'm going to stop and see if there's questions.
Yes, there are, Andy. Yes, there are. I'm going to read a couple of them to you here. How can we advocate for our local leaders to support Biden's vaccine and COVID plans?
Well, first of all, you're going to hear from her later today, but in my opinion, you have probably, I'll say, one of the best, if not the best, health secretaries in the country in in Mandy Cohen. And if you don't know that, and I suspect you do, I think that's a pretty widely held view. Now, I will be honest with you, she was my chief of staff in a past life. And so I got to
I
work
did
with her
notice
hand in
that. I
hand.
did notice that.
Yes. So she is one step ahead. She's truthful. She's clear. She's decisive. She's principled. And quite honestly, she's one of the people leading the way. Um, I would say that one of the areas that is so important is not just getting more Americans vaccinated, but it's making sure that we have real equity in the process. That we don't just have the people with money and technology getting vaccinated and everybody else. By the way, the people who are in communities that are hardest hit, who are essential workers, who are racial and ethnic minorities, who are in a position where they're not getting vaccinated because their vaccines are getting swooped in and taken. Um, North Carolina is one of the leaders in health equity and is doing a great job there. So um, I think you are you are well led here. I think expressing that support and then expressing it at the county level and getting involved, and you'll hear from her later on today. I think it's all very good.
Great. Thanks, Andy. And I'm sure that Dr. Cohen appreciates your endorsement as well. One of the things that we hear from our member companies, Andy, is the concern about employees who are fearful of taking the vaccine. So a question that's come in here is, how can we as employers advocate for our employees to get vaccinated, especially when they're fearful?
So, there's nothing like selling a good product, right? Having vaccines that have had more than twice the size of clinical trials that it traditionally have, with over 70,000 people, vaccines that have now been in several hundred million arms, including these vaccines in the U.S. have been over 100 million arms. That there are a very, very small number of only temporary side effects, and that we are seeing massive amounts of reduction in disease, and people are feeling safe again. So I think it's important to get people the straight facts first. I think if there are people that have questions about vaccines, they're legitimate questions and they deserve straight answers. People don't want to be, in my view, persuaded or manipulated. They just want to be educated. They want to be informed. They want to be told the straight story. So if they're learning about the vaccine on Facebook, that's probably a mistake. They should be learning about the vaccine from people they trust, their doctor, their pharmacist. The CDC has great information. And these information on vaccines are, I think, incredibly, incredibly positive. I think we are finding that people who are sort of fence sitters about vaccines really respond also well to just very simple things, because if it's more complicated for them to get the vaccine, they may be less inclined. So giving them the day off of work or an incentive, or letting them stay home for a day, promoting that, offering people rides, asking them about it. Did you get vaccinated? Do you have questions about the vaccine? Making sure they have access to the fact sheets that come out or that are available on the CDC site. All of those things are really, really useful. People do want to hear from their peers and their boss, not in a way that says you must do this, but in ways in which they can see, oh, everyone's doing this and it appears to be working. And over time, people are getting off the fence.
Yeah, it's interesting because here's a question that has come in, Andy, along those lines. What's your advice for employers considering something between a vaccine mandate and then a set of incentives to take the vaccine? Thoughts about that, or what you're hearing from others about approaches?
Yeah, I have heard from, so I'll tell you one that's been public about it. United Airlines has said that they're strongly considering mandatory vaccinations. I've talked to cruise ships who've said that they're going to probably make their cruises mandatory vaccination, not just for their employees, but for people who are on their cruises. I think sports teams and concerts, and a lot of these are going to be probably popping up as well. So I would say that those are all obviously not government supported ideas. I think it's important that people don't associate that with the government, but it's a fact of life. I mean, my kids, when they went to college, had to show proof of vaccination. That just sort of happened. So as an employer, it's certainly something that many employers are exploring, and having that conversation, that it makes other people feel safer to know that the workplace is vaccinated, to make it easier. It's easier to do that because vaccinations are free and because they've been proven to be safe. If that wasn't the case, I think it would probably be a little bit more problematic.
Yeah, do you think that there will be some kind of regulation that requires it coming from the federal perspective?
No.
Okay. I think that's, from an employer perspective, there's the need for maybe some black and white answers on that, right? So that was a good answer. So it really goes back to more of what you described,
Yeah,
which is
right.
How are we encouraging people, right?
Yeah, look, I think that would discourage people. I think that would probably discourage more people from getting vaccinated, to be truthful, if the government was going to do that. Whereas employers and others, I think, have more of a local relationship. But I think the people who have not yet decided to get vaccine really don't want the government coercion is actually something that they worry about. And so I think that that's not the appropriate role. Yet, having said that, people will have in their daily life things that they probably will be able to do more easily if they're vaccinated than if they're not, and that won't be driven by the government. That'll be driven by the Charlotte Hornets, or the Carolina Panthers, or the orchestra, or the museum, or
Right.
Duke University, or whatever. I'm not suggesting any of them have told me that they are. I'm just saying that over time, that's where I think that will come from, as well as employers. So there will likely be easy ways for people to demonstrate whether they've had a vaccine or not. And when that happens, I think that will make that likely. But you can imagine going up to get on an airplane and being asked to show a little RFID with your vaccination on it, and that will be something for the airlines, not for the government.
Okay, that's good. That's good, helpful information there. Have you seen anything, or what's your opinion about the incentivizing part of this? We've got a question that's been submitted specifically about that.
Lots of employers are doing it. And they report that as part of an overall program and conversation, it's helpful, because and in my opinion, and this is just my opinion, there's something that could feel coercive, like, hey, we're going to pay you to do this, versus, hey, you know what, we're going to, we know you have to be away from work, and we know you might have a headache for a couple of hours, and so it makes every sense for us, if we're going to ask you to do this, to give you some incentive, again, whether it's paid time off or whatever's appropriate for the particular employer. I mean, each of you has your own cultures, and there's certain kinds of things that are appropriate and not in your cultures. But offering people an incentive, I think other employers have shown me, at least when they've done that it has been helpful.
Sure. Well, and that follows along with the advice that we've been giving from the very beginning about creating a safe environment and making people feel comfortable. And so those things all line up, right? I mean, it's about what the overall culture is in your organization. So talk a little bit about, I think your number maybe 3 on, or 4 maybe on your list of initiatives there was around businesses reopening. We have a combination of organizations that are member companies, who some of whom have continued to stay open more in the manufacturing production end of things, but there are a lot of organizations who have certainly been able to work remotely. What are your thoughts or suggestions around the reopening?
Well, I think the number one factor, of course, for everything to be safe is seeing a reduction in cases and community spread. So we can do that, which means wearing a mask for the next, short period of time, and then getting vaccinated. That is the straightest path to things being open again. And look, again, there are some interesting larger questions, as you point out, which is, even as we do that, are there things even with businesses open, are there changes in the way we work and changes in the way we travel and changes in the way we communicate that will stick? And those are certainly far-reaching questions that have less to do with defeating this virus than otherwise. But I'm in the mode of if we were running a very long race and we were in the last couple laps, we could see the goal line, we probably wouldn't stop running just because we could see the goal line. We probably would say, let's finish the journey. So, I would err on the side. Look, again, Dr. Cohen is going to have really more appropriate local perspectives. But in general, I think I need to remind people that even though the news is getting better, we're not done yet. And this can easily come back. We have variants that are more dangerous and can spread more easily. You can easily see, we're sort of in a race against what, if you look at what's happening in Europe now, they've been slower to vaccinate and are now seeing significant spikes in cases again. We, for once, have been ahead of the curve. We've been leading the world in vaccinations, and so far we haven't seen that spike. Now, it doesn't mean it won't happen, and if it happens, it would be end of March, early April. It's entirely possible. So that's why we've been racing it so fast, tripling vaccinations, and not sleeping here, is because if we can get out ahead of it, we can win. But we also want to urge people to do their part, keep wearing a mask until we get to that point, and then we can all rejoice if we do that together. If we quit early, we see the spring breakers and everything. In the past, that's bounced back on us a bit. I'm not saying it will this time, but it has in the past.
Yeah, so you bring up an interesting comment here about the variants, and there's a question that's come in about what is the potential need for either a periodic vaccine or a booster to meet any kind of variant?
We don't know yet, but we're preparing for that scenario. It's not clear that we will need a booster, but all of the major vaccine manufacturers are testing to see whether or not they can have boosters available if they're needed. One can imagine that we don't know the question of what's the duration of the vaccine, but let's say it's a year, could be longer, could be a little bit shorter. Most people I talk to don't think it will be shorter. Most people think that we could be in a place where we have annual vaccinations. Some think it could be every 2 years or 3 years. A lot of it really depends on how quickly we vaccinate the first time, because the variants are created by additional spread, and particularly they're created when they spread a lot in immunocompromised people when they can mutate. So if we do a great job, we'll have fewer variants and fewer dangerous variants, but we will have variants. And the question is, will they be variants that matter? So, we're planning to have the production capability, the science, and the scientific processes to be able to do like we do with the flu shot, which is to create the ability for people to get boosters if they're needed frequently. That is, our science will be able to defeat these variants. But it's not clear yet whether or not they'll be needed. And the most important thing for people to know is if they get their vaccine now, we will reduce the need for this all into the future.
All right, great advice. Andy, we've had a couple of questions that have come in around the OSHA emergency temporary standard. Can you speak to that and what you think is going to happen there?
I can't. I don't have any inside knowledge about what will come next from OSHA. I do know that they are looking at the same issue we are, which is how do we make sure we have a safe workplace, and that employers are indeed making it safe for people to return to work.
Okay. I think we were hoping you'd have a little more insight into that.
I don't.
All right. Let's see. Let me get back to some questions here. Oh gosh, this is a funny one since you've mentioned the Panthers. We have a question about what's your opinion on when you think football stadiums will be at full capacity?
I think forecasting the future is probably not what, so I'm probably not better at that than anybody else. I would say that, look, I would be very surprised if we don't have schools in full strength in the fall, and we don't have, school sports at full strength in the fall. I think there's no reason why that can't and shouldn't happen. And if we have very, very low levels of prevalence and very, very high levels of vaccination, even if we have, the pop-up cases here and there, as particularly if seniors and people at risk are protected, I don't see any reason why that can't happen. Will it happen at the beginning of the season? I don't know. Will it happen at half strength and then three? I don't know. But I'm optimistic. Now, we could be talking in 3 weeks, and I could be more pessimistic if, in fact, spring break gets out of hand and people aren't getting vaccinated in large enough numbers, and we still have many communities that aren't sure if they're going to get vaccinated, and that will have an impact on this. And I think we carry this burden and opportunity ourselves.
Ooh, I love how you just phrased that. One of the questions I think that so many of us have in these days of isolation is, when am I going to be able to travel? So what are your thoughts about travel? And at what point might things free up a little bit more within state to state as well as outside of US travel?
Well, I think we do know that historically we've seen our peaks happen after some of the most significant travel periods. Easter last year, 4th of July, Labor Day, Thanksgiving, Christmas. The travel corridors create really crowded airports, and large crowds are where spread begins and goes and out of control. And as we all know, when things grow exponentially, it's hard to put a lid on it. And you can't chase it very well with something that grows linearly. So, the CDC currently advises us to hold off on unnecessary travel. And I think that's wise. Now, they are looking at it. And I think, they acknowledge the fact that, travel is integral to many of our lives, to seeing our families, to having some sense of normalcy back, and they're very sympathetic to that, and I think they're leaning in quite hard to the question. And it is probably the single most active topic in the CDC right now, is what comes next in terms of travel. They've already released some rules around a relaxation of guidance around people who are vaccinated and things they can do when visiting other people, whether they're vaccinated or unvaccinated. And I call it the hugging guidance, because it's resulted in basically grandparents and grandchildren being able to gather again who hadn't gathered in a year without masks under almost every circumstance. And so they're starting with the important things in life, and they're going to keep going.
Yeah, my poor sweet mom, I just keep saying, Mom, until I'm vaccinated, I just can't hug you.
Is she vaccinated?
So, I'm sorry?
Is she vaccinated?
My mom is now, so she has just gotten her second shot. So
So,
we're in.
so 2 weeks after her second shot, you can't hug her again.
Oh my gosh, she'll be so excited to hear
Even
that.
you can be in the same room with her without a mask, unless you're high risk, which you should
Okay.
not disclose to me here. We're on this call with lots of people, but if you're unless you're high risk for some reason, if one person's vaccinated and the other person isn't, 2 weeks after her vaccination, you can be together without masks.
Oh my gosh, she's going to be ecstatic, Andy. You have probably just made her day, made her year. That's lovely. I may just go over and hug her myself this evening.
That's great. You should.
As we get ready to wrap up, I so appreciate your time with us. What would you predict a year from now is going to look like? If we are a year into this, what does a year from now look like?
Look, I think we're working really, really hard to help both our country and our economy recover. We've got reasons for optimism on both fronts. We're not out of the woods. So I think there's a danger in us saying we're guaranteed to be in a good place in a year, because I think it might cause people to think we're done. We're not. There's a lot of virus spreading around, and we're still seeing, 1,400 people a day dying, which I have a hard time counting that as good news, to be totally honest, although it's a lot better than where we were. But you can imagine a situation where large portion of the country gets vaccinated by the fall. Well, by the summer, that happens, and we've got this thing down to a trickle, and then maybe I think seasonally we have some cases in the fall, the winter, but things we can manage, things we're prepared to manage, and we continue to have our hands around things. I think we will be cautious around certain things, certain people who are immunocompromised, but we'll be in a different situation. And in addition to that, we haven't talked about it, but there's also some very promising therapies, things, antivirals, things that could be oral medications, so that if people do get a case of COVID, they could be able to treat it much, much more easily. So with a combination of these tools from science, you can imagine a situation where this is not something. It may be a fact of life, but it's not slowing us down. We're managing around it, much like we do other endemic conditions. So that's one view of the world. I wouldn't go so far as to say that's my prediction, because I think we have a lot of work to do still.
Any thoughts that you have, Andy, in closing?
Well, I just want to maybe first of all, thank you, Molly, for this invitation, and also thank everybody out there who's listening. I haven't met most of you, but if I close my eyes, I can imagine that you've all been through a challenging year in one form or another, and you've had real difficulties, I can imagine, and yet here we are. We're here, and I think it is something we've shown that I think when we pull together, we get through better, and when we kind of get into our own, we don't do quite as well, and so I just want to acknowledge and appreciate what everybody has done, and for those of you who have frontline workers or healthcare workers in your families, in your businesses, thank you. You have really been people who our whole country is counted on, and so we're going to work very hard to try to finish the job for you.
Awesome. Andy, you have been fantastic. I so appreciate you taking all this time with us, answering all of those questions, giving us your remarks. We are certainly behind you and appreciate all that you and the team are doing on behalf of not only employers, but certainly us on a personal level as well.
And I'm glad you didn't have to look at me.
Well, I'm glad that we thought to make this work with at least your picture up so that people could see who was on the other end of the voice. Truly do appreciate your time, Andy. Thank you so very much, and continue to stay safe and do all this good work.
Thanks. Say hi to Mandy for me.
I sure will. Okay, so as Andy jumps off, we are at time for our employer panel. I'm going to ask those folks to just take a quick minute to get your audio and video to come back up. This would be a quick time if you need to take a bio break, folks on the line. However, we're going to just keep rolling right in so that we can keep our agenda moving. We will take a formal break at about 11:20. So at 11:20, we will take an actual break while we wait for Dr. Cohen to get on the line at 11:30. Before we even start with introductions to my fellow panelists here, what did everybody think of Andy's comments? Sharon, you want to go first?
Absolutely, Molly, happy to do so. I appreciated certainly the information shared, the confidence with which Andy spoke, his straight line answers, and as you responded several times to him, he was clear in his communication, and I made several notes that I will certainly share with our NCA CPA team and with our members. Thought it was very well done.
Yeah, I agree. Marshall or Willie, any thoughts about that? And then we'll do a quick introduction of you guys.
Yes, Willie, I'll echo Sharon's comment. Certainly, one thing that I gleaned out of that was it's incumbent upon all of us to do our part. Not really trying to drive this as a government mandate per se, but more of encouragement. And it's really incumbent upon us as businesses to ensure that we're putting forth mask mandates and social distancing, things of that nature. So it's an all-inclusive effort.
Yeah, I agree. Willie?
No, this was great. It really was. Likewise, I took a bunch of notes, and because we're in the process right now of sort of putting together some policies to bring people back somehow, and this whole vaccination sort of conundrum that we're all facing as to what happens when somebody doesn't, and what he said is all about an education sort of process, and certainly that gave me some really good thoughts about incorporating that into how we communicate to our employees in the near future, what the future may look like. So that was really great stuff, great information. Thank you.
Yeah, I would agree with all of that. I was quickly taking notes, and glad that we have a recording so that we can go back and round out those notes. Let me welcome you each to our panelists. Hopefully folks are now back and listening in, tuning in. Let me ask you all to do a quick introduction and let everyone know kind of who you are. So just a quick, who are you, what's your role, what's your organization, and let's talk about then what changed a year ago for you in terms of how you operate. And then I certainly encourage everybody to put your questions in the chat box as we go through this next session. It's better when it's interactive. I'm certainly happy to prompt for questions that I may have, but also encourage you all to do the same thing. Sharon, shall we start with you? Why don't you give us a quick introduction?
Sure, thank you, Molly. I'm Sharon Bryson. I'm the CEO of the North Carolina Association of Certified Public Accountants. We're a voluntary membership organization, and we represent approximately 13,000 CPAs across the state of North Carolina. So again, happy to be here.
Great. Marshall, how about you?
Good morning, everyone. My name is Marshall Cherry. I'm the Chief Operating Officer at Roanoke Electric Cooperative. We're located in northeastern North Carolina. Office is headquartered in Orlando, North Carolina, and we have service in 7 counties, providing electric service to 14,000 member owners or customers here in northeastern North Carolina, and I serve as the COO.
Great. Willie, how about you?
It's a great variety here. That's awesome. Willie Stewart. I'm CEO and founder of engineering, design, and planning company with a couple hundred employees. We have 8 offices. We do civil engineering, structural. We do 8 different things, and so we're seeing it all right now. We got field people. We got people that are traveling a lot. So it gets very complicated on how we create policies and how we create this back to work kind of idea that we're all exploring now.
Right. So thanks for the introduction. We'll go in reverse order now. We'll start with you, Willie. Tell us a little bit about what happened. So how are your people working? Obviously, they have to be in the field, but there are also people who are working remote. So describe for us what you did to adapt, and we'll do the same kind of thing around so that people understand what were some of those decisions that you had to make and how have you fared?
Oh, so the incredible thing is that March 16, today, a year ago, 2020 was a Monday. And we have met the Saturday and Sunday the leadership had about creating sort of what we thought was going to be a temporary situation, right? We all thought this was going to be done in a couple months. So that Monday we sent everybody home. And frankly, we had done a lot, just purely by coincidence and luck. We had upgraded a lot of our IT systems the previous year. So within 24 hours, we were able to get everybody pretty much up and running with lots of, I need another monitor, my Wi-Fi is not, the bandwidth is not enough. So a lot of little things that we worked through. And then we started the conversation as to how to work remotely with everybody. Again, we didn't think this was going to last the way it had. But as we got into April and May, obviously there was a lot of moving parts. We went ahead and signed up with an app called Cooperate. And this app then allowed people, and we launched it in July. So our phase one was everybody working from home, nobody at the office. It allowed us to do all the PPE, all the plexiglass, all the signage and everything else. But once we got the app up and running at the end of July, where people actually had to sign in to be able to come to work, and they had to answer all these questions that we all answer now when we go somewhere. Then they got a sort of like a green light, a green passport. And then we started allowing people to come in, obviously, if they got the green light to come in. And then once they walked into one of our offices, they had to check in. That allowed us the whole contact tracing that came with the whole later on. We all started learning about all these new words, all these new statements. And we've been doing that. So we're still in that phase. In that say we get probably anywhere from 12 to 18 people that come to our collective offices on a daily basis. Hopefully that kind of answers your question.
No, that's great. That's great. Marshall, how about you guys? Much of the work that you do is hands-on.
Absolutely, but I will say that listening to Willie kind of triggered something for me. I guess you could say it was kind of serendipitous, really. We back in August of 2019 went through a simulation, whereas we did a disaster recovery exercise to determine if we had the ability, whether or not we had the ability for all of our team members to work remotely in the event that our entire office was wiped out during a storm, knowing that we needed to be able to still respond and give updates. So it was quite interesting that we did that, because we did learn that we had the ability to do so during that discovery. And I'll say one other thing that really jumped out at me as Chief Operating Officer, efficiency is real big for me. And I'll even say down to our meeting management, the resources that we use to have meetings, how efficient are we as an organization. So really, we had started exploring using a system like Microsoft Teams before the pandemic, but we were not using it. But the pandemic really forced us into using it, and it is really now, I know it will be a part of our new norm in terms of being an organization that's more efficient. But to answer your question, due to the essential nature of our business, we did have to take a hybrid approach. There are some team members who are working remotely. We also have some team members who do have to come in the office because of the essential nature of their jobs. And so some of the things that we did, the more that we learned about social distancing and the impact of masks, we implemented a mask mandate inside of our facility because we knew that folks needed to come inside the facility. But we did for maybe 6 or 7 months, I can't remember, but this is parallel to the governor's moratorium on disconnects. We actually closed our building to the public during that period due to that moratorium, whereas we suspended the disconnects for non-pay. So we had member owners actually report to the office, and they made payments through drive-through because there are several of our member owners, who do not use technology to pay their electric bill, but certainly we wanted to give them the ability to do so. So we opened our drive-through. No one was coming in the office, but we collected payments, even though there was a suspension on disconnects. We knew that there were folks who would want to pay. So we have 2 construction crews, our line crews. What we're doing with them is, and still doing it today, is we stage them about 90 minutes apart so that we can support, the social distancing, even when we have to have briefings with them when they do report. There's one group, I believe they come in around about 6:30 or 7, the other about 90 minutes after that. And if there are briefings needed, then we would do, multiple briefings. But the idea there is to ensure that we create the spacing as need be. And for our internal staff, originally our administrative support beyond our customer service team or member services team, who was coming in quite often, we actually had team members coming in on a rotation of about 2 to 3 days a week until we actually learned more about the self-quarantine, the 2-week quarantine. So once we learned more about that, whereas you could have a team member report for a week, then take 2 weeks out of the office to ensure that there's some level of a self-quarantine, we put that into practice. So we've been doing that still for many of our admin staff members, but our member services staff, due to the nature of their work, they're coming in every other week. So they're on a rotation so that they can continue the camaraderie and cohesive nature of their unit and working very closely with our member owners. Obviously, we stopped travel once we, went into that mode. And another thing I will say is the impact that this had on our broadband business. I didn't say this in my intro, but of course we provide electric service, but we, for the past several years, have been kind of launching a broadband business due to the nature of not having high-speed internet access here in Northeastern North Carolina. And we learned a whole lot about that even during this pandemic, the impact it has on folks, outside of our business. But in doing that, the point I'm making operationally is it did slow us down to a certain degree because we limited our ability to go into people's homes, things of that nature, making sure that we had masks, our guys had masks whenever they interacted with anyone. And so that did provide, that did slow down our process somewhat. So we've seen some impact, but certainly we're working toward, very interested in hearing more about how we're going to move forward with how we handle the return to work policy.
Yeah, I think you and everybody else on the line is really, focused on that. So it's a great segue to you, Sharon. Why don't you talk a little bit about, I know you shared with me as we were preparing for this conversation that you weren't a fan of working remote prior to, or go back a year or so ago. So why don't you share a little bit about your perspective and what lessons you've learned over the course of this past year?
Absolutely, Molly. Thank you. We have a team of 30 people at NCACPA, and our culture is of primary importance to all of us. And we've worked hard on that, and we work hard on it on a daily basis. And so I've always been a big fan of togetherness, and have felt like that was a very important aspect of our culture. As we transitioned, and there are a lot of parallels in terms of what we did in comparison to what Marshall and Willie have said here, we had done a lot of prep, and again, Marshall's word about it being serendipitous with respect to our technology. So we had laptops and we were ready to go. We called people into our conference room that fateful Friday, the 13th of March of 2020, and hoped that we would be back in a couple of weeks, but we were prepared. There was also some reference here to having tools like Microsoft Teams that we had not fully utilized, and so we began to do that. And if I have learned any lesson, and certainly there have been many, Molly, but I believe that what people want need and deserve, if it's available, is flexibility. And that has been something that has worked extremely well for us. Our team has worked remotely since March 13th and continues to do so. Now, of course, the guiding principle is safety. Another guiding principle is certainly service to our members. And we have been able to provide that level of service. And I have seen our team do amazing things day in, day out. And based on what I've seen, and this has been referenced also by Marshall and Willie, we will continue some form of hybrid work. And Andy said this, none of us have a crystal ball. We cannot predict the future. We're all focused on safety, and I'm going to continue to be focused on flexibility for our members as well as our NCACPA team. We're hoping to have some change in the fall in terms of live programming for our members, again, in a hybrid format, have some flexibility in terms of our team being able to come into the office on a more frequent basis. But again, no decisions about specific timing, because we just don't feel like that's necessary. There's so much stress involved in what's going on while things are certainly looking better and feeling better. But again, I'm just so amazed at what our team's been able to do remotely, and I will continue to lead a flexible charge as we make decisions in the future. The other thing that I will mention that's been so important for us, we have a internal workplace reentry team, and they've paid attention to the science, the trends, and have made recommendations that we have followed and will continue to follow. So that's been a big plus for us.
Yeah, I think, what you're bringing up, Sharon, is an example of, I think, how the shift in thought process and perspective really, in the beginning certainly was all about safety and how can we keep people safe. Now you're really adding something else to the equation, which is from a satisfaction standpoint. And, however you define that, your word of flexibility, I mean, I am queen of flexibility. I do believe when able to, we should be able to have flexibility in our work, whether it's from a scheduling standpoint, from a location standpoint, et cetera. I think gone are the days of, you're only going to work from 9 to 5 when we continue, at least for the immediate future, to have other commitments, whether it be a school commitment or something else in your household that needs to be managed as well. So being able to even allow that kind of flexibility is within the schedule itself, right? Your productive day versus just even coming into the office versus not.
Exactly.
Right.
I wrote a note to our team actually commemorating our anniversary, and I was thanking them and congratulating them. And in my message, I referenced, we're taking care of pets, we're taking care of children, we're taking care of parents, we're trying to take care of ourselves in some way, shape, or form. And then, of course, the work that we do is so important. So it's that work-life integration.
Right. Absolutely. So Willie, when you and I were talking, one of the things struck me about your description of kind of how you've adapted is from a recruitment standpoint and where you have your employees now with maybe different skill sets and in different locations and how you're staying connected. So can you maybe share with everybody what you've done and what that looks like for you?
I'll tell you, we're actually kind of excited to some of the things that developed, right? Not only learning to work remotely with high utilization, high productivity, and frankly, we just did a survey. The results came in yesterday, and I was quite impressed. I mean, it was a very intense survey about coming back, but we found like 94% of our employees are either burst of sun, all sunshine, or mild. So they seem to be in a good place right now. And then we have some that want to come back to work, some that want to work flexible. You talked about flexibility, and you talked about we have about 10% that are ready to come back. about 40% that want to come back 2 to 4 days a week, and 34 that say they want to come back in the near future. So that's kind of been the breakdown, with about 18% that actually want to move to a work from home, 100% of the time. And so from the recruiting side, first of all, we already have people that have been working. We have 2 people in Atlanta. We got somebody in Portland, Oregon. We got 3 people in Richmond, Winston-Salem, Denver. So we got people already that had moved prior to the pandemic, actually 2 moved during the pandemic because they wanted to be close to family and they knew they could work remotely. But what this has done for us as an organization is open the entire country for recruiting talent, for going out to the Bostons, Chicago, New York, go to California and recruit talent that sometimes we can't find here, and they don't have to move anymore, right? They can just be part of the organization and be part of the family, even though this is the kind of connectivity that will take place through a virtual world, which I would say, I think that our employees have connected at a much higher level than they ever had before. This is crazy, but the daily calls that for instance, our structural team is doing every single day, they're having a call, one at 8, one at 8:30, 15, 20 minutes, sort of stand-up calls, like an agile management system, and they're connecting, they're talking, and obviously for introverts, they're loving it, and kind of force them to turn the cameras on because they don't want to be seen. But other than that, there has been a lot of connectivity, face to face, and it seemed to be working. So we're looking forward to and we're in the process already. In fact, I'm from Colombia. I'm in Colombia next week, and I'm talking to an engineering company over there and see if we can get some support from them. So it's and now in the past, that was always the challenges. How do you do that? And like it was mentioned before, Teams and Zoom. I mean, this is our life. This is our world today. That we have gotten used to it.
Yeah, I would absolutely agree. We've heard from a number of companies that it's just we've opened up the borders just simply because we don't have a requirement. In some cases, just like you described, Willie, there are people who needed to move or might have just left a job before, but now they can continue to work in this kind of capacity. Marshall, talk a little bit about the cultural piece of that, and how have you all stayed connected with one another? Because there's certainly, we all know the Zoom fatigue and how that is having an effect on people. Yet it's a great tool, whatever you're using, whether it's Teams or Zoom, any kind of virtual platform. It gives us the opportunity to eyeball one another and be connected, even better sometimes than when you're at work with the mask on, right? You can't see expressions as much when you're all together, but you certainly can see it here. So what are you guys doing to address that or create that sense of connection?
Yes, absolutely. We're having quite a few. I actually received the report. Of course, I was behind the effort to launch Microsoft Teams in our organization. I see a lot of activity from many of our employees, whether they're on video calls, they're actually participating in meetings, they're using chats, they're posting messages through channel. So we see the interaction. We see that there's a lot of activity, and I really feel, to be quite honest, we're more connected because of the fact that we do see each other more often like this. I get it from a personal standpoint, and certainly we want to make sure that we can create a hybrid moving forward. But I would dare say that there will be a lot of this level of interaction, and two, the productivity is higher as a result of it, because in many cases you're probably not dealing with the 15 or 20 minutes that may be spent after the meeting, having the meeting after the meeting, right? We've already covered everything that we need to do, and I'm finding that we're more efficient with our meetings, our agendas, setting our agenda, trying to make sure that we're on time because of the fact that there's so many folks who have a meeting that's following a Zoom meeting, because there's a lot going on throughout the day. But I will also say that we do pay attention, and a good example of this is, we have team members who have children at home. We want to make sure that people are not having to feel guilty. As a matter of fact, just yesterday I was on a call, one of my team members, their son came in at the end, and I don't think I know it's important that I set that tone as the chief operating officer to say, hey buddy, how you doing? You know, and so things like that, and making sure that people feel comfortable, because we realize that people do have lives at home, and it's a part of the nature of, you know, what comes with being, I guess, an all-inclusive adult. So our culture is really growing through this, and I really feel that this pandemic is going to set us up to be very successful in creating a culture where we're connected more moving forward.
Sharon, as we move into you, I'm going to say let's make sure we're giving an acknowledgement here too. Part of this is because of your leadership, and so I am going to commend you all for helping to shift that. Right? I mean, I think we're at an interesting time in history where it's coming from both sides. Right? I mean, there's a need, like we don't have any option. Right? For those of us who all went home, you have to figure out how to make it work, but it's how you're leading through that to make it work for you. So Sharon, why don't you talk a little bit more about that? I mean, like how, when you started out your comments, you said, I like to be able to be connected with people. How are you guys doing that? And what does that look like? Is it just in meeting form? Are you doing other things? How do you even get at some of those things that might happen after the meeting? What's your thoughts or perspectives on that?
Well, I think that from an efficiency standpoint, and Willie and Marshall both mentioned this, for our membership, the participation has been significant, not just with regular committee meetings or with our educational programs. Certainly our CPAs are in the tax season that never ends. So again, that has been very helpful, and we've been able to communicate through video. We're trying not to inundate inboxes any more than we have to. But I would say, Molly, from an internal standpoint, we have monthly staff meetings, we have departmental meetings. Our leadership team has a meeting every Monday morning called our tactical meeting, where we cover the landscape for the week. One of the most effective things that we've done that has had nothing to do with Zoom or Teams is an idea that our director of finance came up with, and it's called Chronicles. And so every week, we, from a departmental standpoint, we submit in writing, in email to our chief operating officer, here's what's happened in our department this week. Here's what we've done. Here's what's about to happen or what's already happened. And our COO takes that information that we share on Thursday, by the end of the day on Thursday. Sometimes I'm a little late. And again, our COO, Mark Sadacek, takes that information, compiles it, and he creates an intro, an email intro that he writes beautifully. He's humorous, he's factual, and it's something that I believe we will do when we return to whatever normal looks like. But it's been a great way to communicate. It's something that our team looks forward to. And one of our team members said, I feel like we communicate more now than we ever have before. Now, that it sounds so simple, but it's one of those things that we didn't do when we were all together in the same building. But it's just been fantastic. And the last thing that I'll mention, we call them daily huddles. The COO and I, we meet for 15 minutes every day. We sit every now and then, but those huddles, that quick chat, I can't imagine not having those huddles now. So we will walk down to, when we're back in the office, we'll walk down the hall and we'll have that huddle. So I feel like all the examples I'm giving are somewhat simplistic, but you know, Molly, as you and I've also discussed, I also, my mantra is simple is always, in my opinion, or almost always the way to go. There's no need to overcomplicate things. So I can't, from a leadership standpoint, I don't feel like I can take credit for much of that, but it's been something that I'm going to make sure that we continue to foster.
Yeah, I would agree. I mean, we're certainly hearing all of those examples, yet creating this as part of our ongoing culture is the key, right? There isn't a one of us who wouldn't say, we worked with teams of people who said communication is absolutely important, and even when you're doing a good job, maybe we could have done a better job. In this case, we are that much more connected with folks. I think it was maybe either Willie or Marshall, you referenced the chats. What I would say via the online meeting, we're seeing even internally more people contributing and being a part of meetings because you can easily put something in the chat. And so we are totally embracing that opportunity, I believe, to have that kind of live interaction. So when we have our daily check-ins, and for those of you on the call who know, we have, in the midst of COVID, we've merged organizations. And so the Employers Association in Charlotte and CAI in Raleigh and the Triad have come together to form a new, twice as big organization. And so in between COVID challenges, we were then also working on a merger, and not being able to see one another was really problematic. So we embraced the whole idea of the online and have really seen, I think, great participation from our team. I'm very proud of everyone because you do it. Like you just say, you know, whether you're going to say it out loud or you put it in the chat, and and again, it's I think really working for us in a way that we would have perhaps not had good feedback and not had good involvement from all of our employees. So there's something about that introvert extrovert piece that as well I think can be managed in this. That is, it's funny, I think you've all maybe made some reference to the, do you keep your video on or not? I think that that's you know, an ongoing challenge for people. Yesterday I have to tell you, extraordinarily happy. Our CFO and I did a phone call, and I could walk around a little bit while I was doing it. I was like, I know what your face looks like. She knew what mine looked like, and was like, we need to do this a little bit more often because there are times when it's too much. And so a phone call, an old-fashioned phone call can work, but what are the times in which? And I think that's where maybe I'd be curious for your thoughts around how do you set some of those standards or policies maybe as we think about moving forward? So, you know, we've all just kind of adapted, and you've all given great examples of what that looks like for your organization and even the evolution over the past year. So in our last few minutes, like, what are those things that you might be looking to either continue with or make more formal, maybe, since we're not just all of a sudden going to, on a dime, go back to what we used to know a year ago?
Yes. Okay.
Marcia, want to go first?
Yeah, certainly. To answer your question about the phone call piece, I would say definitely a one-on-one is very reasonable, but I'm learning that I do not favor conference calls now. I do not, because people are always talking over each other because you cannot see the person. You don't know when someone is trying to say something, but on a Teams call, you can actually see the person, and you can, you know, be more mannerable and say, okay, I see that you're trying to say something. So I'm really not, and I'm here lately, there have been some organizations, clearly that's their way of doing business, and I cringe when it happens, but nevertheless, you know, I follow through with it. But also I would say one other thing I wanted to highlight, I didn't say earlier, is the social aspect of this as well has really enhanced our work when we're trying to bring our teams together. We've had a lot of virtual fun activities that have gone on during the pandemic. Just here recently, during our employee training day, we were able to break up our entire team into about 5 or 6 team members doing a murder mystery. Whoever finished first, once they won a prize, things like that. So the social aspect has been great as well. And one other thing I'll say is, even from an email standpoint, Sharon was talking about this earlier. I'm finding that I do not send as many emails as I used to because they can get confusing, and they can take a life of its own when it comes to the communication. So when I see someone send me a very long email, and I know it's going to take me a whole lot of bullets to reply, I'll just go ahead and reply. Look, let's just talk it out because this is going to get to me. It's going to get too confusing. I have an opportunity to connect, and the communication from me is clear.
Nice, great examples, great examples. Willie, how about you?
No, I agree. I think that technology has elevated at least everything we do to another level. And in fact, I was just thinking, just purely from the automation point of view, usually our calls requires like sharing screens, sharing spreadsheets, sharing a PowerPoint. It is easily done than if you're like face to face, or you needed to talk to 3 people, or somebody's in Durham, somebody's in Charlotte. I mean, that whole connectivity that you just mentioned, it's real, and I think it will continue to a higher level. On Marshall's note about the social piece, let me just quickly just highlight something we did over the years. Pi Day was, it's March 14th. It's 3.14, and every year we had delivered pies to our clients in Charlotte, in Durham, in Raleigh. Well, obviously this year we didn't. So what we did instead is we had, there's a very well-known chef in Raleigh, in Durham, Giorgio Bacascia, who owns Parasites and Rosewater. So we did a pie. He cooked pies in the kitchen of one of his restaurants, and some of us showed up with masks, and we did a pie cooking video that then our practice leaders participated in their homes, and then we invited all our clients and all our employees and colleagues to come and watch the video, followed by a Q&A. So these sort of activities that create a lot of interaction, and we did wine, and we sent some gift certificates to our clients so they could go buy the ingredients for these pies that Georgia was making, is something that we're going to build on in the future. So how can we take what we just learned, because it was pretty intense and sophisticated to try and do. We had 5 people, 3 cameras going through all this, and how can we do this in the future? To promote our brand, or just share with our clients things that we're doing that perhaps we hadn't thought before. So there's a lot of things that are coming out of this sort of change in the way we work that are really, really positive. Just one last thing, and I don't want to take too much time, but we work with municipalities, and we work with them on their comprehensive plans and their UDOs, and we often have what's called public involvement. We invite the public to come to a meeting, and we show them what we're doing. And typically it said there'll be 30, 40 people there. We're doing this virtually now. I mean, there's hundreds of people showing up at these events.
Oh, sure.
So for the municipality, for the town that we're working with, they're getting feedback from 2 and 3 times more people than they ever had before. Therefore, they're getting a better product than they had before. You got more opinions and more thoughts. So there's a lot of positives that have come out of this. And yeah, Zoom fatigue and all those things that we talked about, but I try to emphasize that the automation part and has given us some things that we hadn't thought of before.
Yeah, I would agree. Sharon, and closing thoughts for you?
I just think that we have to keep taking advantage of the fun and the celebration and the social aspect of what we're doing, because I'm cliches here, but life's too short not to stop and smell the roses. So we're doing a lot of the same with socials with our board of directors. We have a So Wow team that works on activities on a regular basis, and we stop and we celebrate each other, and we have some fun, because don't we all need to laugh? So that's my parting comment.
Yeah, we most certainly do. We most certainly do. You all were fantastic. Thank you so much for your demonstration of leadership, for giving us an insight and perspective into what's happened in your organizations over the past 12 months, some good lessons learned and some good inspiring ideas that hopefully the folks on the call will be able to take back and integrate into their organization as well. We are going to take a quick break. We will be back on. Dr. Cohen will be speaking with us at 11:30. Everyone go take a few minutes. We'll be getting her on, give or take, at 11:25. So once we're up and running, we will look to get started right back promptly at 11:30. Thank you all. I so appreciate each one of you, and we'll be back shortly. Thanks, everyone. Taking a break. Welcome back to everyone. Appreciate everyone taking a quick bio break and getting back on time so that we can start up with Dr. Cohen. Dr. Cohen, I did share with you when you first logged in that Andy Slavitt had wonderful things to say about you. So the audience your praises were being sung by Andy. We have you for the next half an hour. I understand, like in times past, you are going to share with us some of your thoughts and comments, and then we'll have an opportunity to answer questions from the audience. So I encourage everyone to please put your comments and questions into the chat box, and I will be fielding them as soon as Dr. Cohen is done with her remarks. The floor is now yours, Dr. Cohen. Thank you and welcome, and we appreciate you coming on back to talk with us and giving us an update.
Sure. Well, thanks, Molly. And first, I apologize. I was trying to change my name, and it says Amanda Parks, who's my wonderful assistant. But hi, I'm Mandy Cohen, Secretary of the North Carolina Department of Health and Human Services. And just wanted to appreciate the opportunity to be back. Lovely to hear that Andy had nice things to say. I was sharing with Molly that he was sort of like my work husband. I worked for Andy for a number of years as sort of his right hand at the federal level, and frankly, learned a lot about leading in a crisis and leading large institutions directly from Andy. So it was great that you guys got to hear directly from the source. I know he's incredibly busy, so it was a big get that you got his time this morning. So what I thought I would do, you heard the national picture. I thought I will share a bit just about what's going on in North Carolina. I know a number of you are here in North Carolina, and thank you for the ongoing partnership. The public-private collaboration through this entire pandemic has just been remarkable and continues at every turn. And I think the vaccine effort is just yet the newest chapter in that, and it's been great. But just as a summary of like where we've been taking a step back in North Carolina over the year, on our first slide here is just overall, I'm really proud of North Carolina's work, and frankly, the numbers tell the story for us. You know, as you look at the rest of the states in the Southeast, you know, North Carolina has less cases, less hospitalizations, less deaths. We've never overwhelmed our hospital system. We avoided those two major surges that the Southeast saw back in the very early part of the pandemic and then over the summer. So like everyone, we had a pretty tight time over the winter, and January was our peak, but we've done a really incredible job, and I attribute a lot of that is to our data-driven approach. We really focused on being transparent in our data and using that and the science to drive our approach to this pandemic. That included one of the earliest mask mandates, very measured reopening, a very extensive public messaging campaign on the 3 Ws. Anyone who's lived in North Carolina has heard 3 Ws a lot this year. And I think that's continued into putting all of those lessons to work for our vaccine operations. We have definitely built equity into every aspect of this response from very, very early on, and how we work with communities, whether it was how we arranged for testing access, or how we plan for support for those who needed to stay home or isolate or quarantine because of COVID, but we know if they weren't at work, that doesn't mean that they can still put food on the table. A lot of folks are gig workers, and if you show up, you get paid. You don't show up, you don't get paid. So we put a lot of effort into making sure that folks had wage replacement options, transportation, food delivery, those kinds of things, in addition to the important testing and other protective equipment that we absolutely needed. But I will say this has been a hard year from a response perspective. There was a lot we needed to build from whole cloth, whether it was our hospital surge capacity planning and just really rethinking how we work together as one entity across our state, how we did PPE. And I think this is actually a place where we did not do well at first, and where there were entities like almost fighting each other for those same precious resources. And there wasn't that same coordinated federal response. I think we've learned that lesson and put it into vaccine effort. As you can see, the federal government's doing all the purchasing of vaccine. And then we at the state are doing distribution. We should have been able to do that on the PPE as well. But again, we're learning our lessons, but we did that here. So it means we had to purchase and distribute the PPE. Remember a year ago, right now, we had no testing for COVID a year ago, last year. So it's incredible that we have built an entire testing infrastructure, done more than 10 million tests in that time. But the other huge thing that we built was a data infrastructure. We had no visibility really into how many COVID patients were in the hospital or not. Were they in the ICU, not in the ICU, on a ventilator, not? What was going on with our testing data? We got positive tests most of the time, but we didn't get negative tests, which didn't allow us to really understand the scope and scale of what was happening. So a ton of work there, and contact tracing more and more, but also now into our vaccine efforts. I think this has been another frontier where we put a lot of lessons to work, and I'm going to dive in mostly today to our vaccine efforts. But before I do, let's go to the next slide just to show you our trends. Again, like I said, data-driven approach. This is something, if you tuned into any of our press conferences, every few weeks, I go through these graphs. I will do it again with the governor tomorrow at our press conference. And what you can see on January 10th is really when we hit our peak of cases here in North Carolina. And since then, we have been on a slow and steady decline. I will say I see that decline sort of slowing. And looks like what the rest of the country is seeing is a plateauing. Now we're plateauing at a lower level, which is great, and we have vaccine out, which is great, but we still have a lot of virus here. We added another almost 2,000 cases. We still had, you could see our hospitalizations have gone way down, but we still had 100 new people get admitted to the hospital with COVID last night alone, just in one night. So, we still have virus around, and the map at the bottom really shows that, right? There are still red counties where we're having critical levels of viral spread. Now it's much, much better than when we were at the beginning of this year. So in just a few short months, we have made dramatic improvements, and I think a lot of that is driven by our vaccine effort. But you can see we still have work to do, particularly as the fact that what is really limiting us at this point is vaccine supply. It's improving, that's really good, but vaccine supply is limited. You can see now on the other side of the screen here on our vaccination efforts, we've given out more than 3.3 million doses of vaccine already. That means 20% of our population has at least partially vaccinated, 12% fully, and that is based on an entire population. If you look at just the 18 and over population, which is really the only population eligible right now, those numbers look even better, which is remarkable. The fact that we are sitting here a year into the pandemic, and I know it's been a long and hard year, but that we have 3 safe and effective vaccines that we're getting out, that we have more than 20% of our population at least having a dose of a vaccine, I mean, is really, really remarkable. And what I'm proud of is not only are we doing things fast, we're doing it fair. And that's what we are, as you look at some of the data, and I'll go into this a little bit more, we really are focused on equity. And what you can see, the purple at the bottom is the percentage of vaccines going to those who are white. But what is improving week over week is the percentage of vaccines going to our African American. That's in the blue there, and you can see it getting larger. And about 20% of our vaccines week over week are going into African American arms, which is great to see. All right, so let's just dive into a bit of like what's happening with vaccines. You may have heard this from Andy Slavitt this morning, but just to reiterate, how did we get here so quickly, right? Some people equate speed to potentially cutting of corners and can we trust the vaccine? But what I would say is that the scientists on this have done a remarkable job, but also had the ability to build on years of scientific advancement that they've been working on for many years, and it was just very fortunate we were able to build on those years of work and then really parallel process a lot of the steps in the vaccine development, including manufacturing at the same time that they were testing, which in normal circumstances very unheard of because it's just a big financial risk, right? And many companies don't want to take that financial risk. The federal government said, we will take on that financial risk for you. Let's start making the vaccine before we even know if it's going to fully work. Luckily, we now have 3 that have been tested and have been authorized for emergency use. And I want to come back to the emergency use because I think for employers that is an important component as you think about, well, can I mandate or can I not? I think it is important to really understand that this is not yet a approved vaccine, but it is approved for emergency use authorization. So the vaccines, again, safe, tested. You can see more than 3 million people have gotten vaccines. And importantly, I think everyone needs to remember you cannot get COVID from the vaccine. You are not injecting a weakened form of COVID-19 into your body. You're actually injecting, what you are doing is giving your body the tools to train it so that if it sees COVID in the future, it knows how to fight it off quickly, right? So it's teaching your body how to build antibodies without actually giving you the COVID virus, which is awesome. I mean, that's a scientific advancement here. And as I said, our limiting factor at this point in North Carolina is really about supply. We know we have more capacity to get out vaccine than the supply is, but it has been improving. When we were first doing our vaccination efforts, we were getting about 120,000 doses a week. We are now getting about 240,000 doses a week, so more than double almost what we were getting in mid to late January. We are double that, and I was just getting off a phone call yet again with our federal partners who are sharing that in the month of April we expect that vaccine supply to really increase a lot, which is why President Biden was able to say, by May 1st, we think every adult will be eligible. That doesn't mean they will get an appointment on May 1st, but will be eligible for vaccine. And North Carolina is on track on that pace as well, and I'll go into that more. Next slide. So just a reminder on the various vaccines. I've been talking about 3 of them. Pfizer and Moderna are the 2 shots, 2-shot vaccines. And again, the second shot comes either 3 or 4 weeks after. And then it's about another 2 weeks after that someone can say they are fully immunized. So when we are giving recommendations of what you can do when you are fully vaccinated, that is 2 weeks after your second dose of Pfizer or Moderna, or 2 weeks after your Johnson & Johnson vaccine. Again, the Johnson & Johnson, I think, is a great alternative, particularly for those who may be not in the same place to get their second vaccine. I will say I got the Johnson & Johnson vaccine. It will be about 10 days ago now, 11 days. So these are all 3 very safe, effective vaccines. And it's really important, though, that if you are getting the 2-dose vaccine, to come back and get that second dose. That is what has been studied. And we want to make sure we're following those protocols. And we are tracking all of that so we can help folks come back for their second dose. The good news is more than 90% of people are coming back for their second dose, which is great. But we are tracking that data to make sure that folks are coming back for their second dose. Next slide. So we have a lot of information because things are changing often. Just so you know where your centralized place for information, yourshot.nc.gov. So if there's updates to eligibility groups, you want the deeper dive. Where does my particular industry fit in all of these eligibilities? I know that it's been confusing because every state is doing it slightly differently. I think we're all heading in the same direction, but there's just tweaks across state lines, which I know can be hard to track. But that's where you can find your information. If you want to know what group you personally or your employees fall in, you can go to Find My Group. What I like about that tool, it walks you through answering some questions, but it takes your information as well. So when your eligibility group comes up, we will also alert you that it's happening ahead of time so you can get in line to get your spot. There's also Vaccine Locator. Find My Spot helps you find where there are events, throughput. And I'll say there are appointments opening up every day, whether that's through our Walgreens partners or through our hospitals, our health centers, our public health departments. So there are vaccine appointments opening every day. You can call our call center as well. And I'll go through how employers can engage with this process. There are high touch things you can do, like bringing a vaccine event onto your campus or helping your folks navigate some of these tools right here. Next slide. I'm really proud of the work about equity, and I just want to hit on that a bit, is that, and it shows in the numbers, it does take time to make sure that we can reach all communities. And what we have seen is that hesitancy is something that exists across all populations, white, Black, whomever. Sure, that we understand that there can be hesitancy because folks want to understand and get good information about this vaccine. Again, your spot, your shot.nc.gov, good information. But what we have seen is if you bring vaccine close to folks' homes where they work, make it convenient, actually work with them to get appointment, right? A lot of folks are just not sitting by the computer to refresh to get the appointment. So yeah, it does take a bit longer to get them, but this is where partnerships have been critical, and love for employers to be part of this solution, particularly for your employees, where we've worked with the faith community as one example, but there's been many, where they have helped to fill appointments and make sure that people in the African American churches are getting appointments. Sometimes they're hosting the events right at their church because it's a trusted space. They get to see their clergy member get vaccinated and they get vaccinated. We're also allocating additional doses to counties who have a larger historically marginalized population. So if they serve a larger African American community or a larger Hispanic community, we allocate more vaccine. And then we ask our providers to vaccinate it at or above what the population they are serving. And if they don't, we show them their data and say, I need to know how you're going to make improvements, or we're not going to be able to continue to give you vaccine. We're going to work with other providers who can work closely with the community and do it in an equitable way. We've leveraged community health workers to address this. We're doing that particularly at the federal and state site in the Greensboro area of North Carolina, where we're doing 3,000 vaccinations a day. We have community health workers who both fill those appointments and work on site. I happened to be there yesterday. They are awesome and are just doing such a great job. It's really important to have that connection back to the community. Next slide just shows a bit about our data here, where we're committed to making sure we're getting things out equitably. We have more work to do here, but as I said, African Americans represent about 21% of the North Carolina population, and they are getting more than 20% of the vaccines every week. We have more work to do in our Hispanic community in particular, and we know there are additional barriers there, language and other. So that is a place of focus for us over the last number of weeks, and we're making a lot of progress. We've actually doubled our ability to reach that community, but we know we have so much more work to do. Next slide. Just to get into the prioritization for vaccine and where North Carolina is, this is how we decided to go through it. We really looked at two principles. We wanted to look at who was both going to have the worst outcomes from COVID and who had the highest risk of exposure. And so that's how this came together. So healthcare workers and those in long-term care facilities have both of those things, right? Healthcare workers certainly have the exposure. Long-term care at some of our most medically frail, as well as living in a congregate setting, so they have both. Then we went to older adults, those 65 and up. That was really looking at our data. Again, data-driven approach. We saw that more than 80% of those deaths in North Carolina because of COVID came from those who are 65 and up. Now, it's not perfect. None of this is perfect. Again, I wish I had supply for everyone, but that really helped us risk stratify to those who are at the highest risk of bad outcomes were those over 65. And we were the #1 state in the country in vaccinating those who were over 65. So I'm really proud of that. I really think it helped us target to those at highest risk. Then we wanted to get to some of our frontline essential workers. These are folks who have to be at work to do their job. Police officers, teachers, some of our folks who work in agriculture and meat packing plants. So there are a lot, manufacturing, there are a number of industry, you have to go to work. And this is where the linkages to the employer community have been really important. We're doing a lot of occupational health events related to this. And starting tomorrow, we're going to be opening to group 4 there in the orange, starting for folks who have a medical condition that might put them at higher risk. So they're under 65, but have a medical condition. That can be everything from diabetes, heart disease, cancer, to obesity or smoking, even 100 cigarettes in your lifetime. So we know that's going to be a big group starting on Wednesday. And then we move on from that to some other other essential workers, and I'll go through that in a second, and then to everyone. And like I said, I think we are well on pace in North Carolina to meet the president's goal of having all adults eligible by May 1st. Next slide. Okay, so I won't go through this in detail, but just the deeper dive of who is in group 3, who are we vaccinating right now. There are 8 sectors, everything from transportation to critical manufacturing, education, essential goods, food and agriculture. I encourage you to make sure you know who, if you fall into one of these. Next slide. And then in group 4, as I said, we're getting to that place where we are, they're going to be folks with an underlying condition. This may be, if you're not one of those sectors, this may be the majority of your workers. We know that at least half of adults in North Carolina have one of these high-risk conditions. Now, many of them may be over 65, and they've been eligible, or they work in other kinds of settings, but do know this may be where a lot of your workers may become eligible starting tomorrow, and they be starting to seek out vaccine. On April 7th, additional essential workers will be eligible for vaccination. Again, I encourage you to go to my group finder on our website, and it'll help you walk through, are you an essential worker or not? But like I said, I think we are in the weeks away from everyone being eligible, not months, which is great. Next slide. So what do you do as an employer, right? This is the takeaway here for you. And it really depends about how you are situated, how large you are, and how you want to get involved. And I will share how I have done it as an employer. I have 18,000 employees, and we've done a mix of these strategies. Sometimes you want to get the most involved, and you use your occupational health arm because you have a large campus or people together, and you can actually use your occupational health arm, get vaccine allocated to you directly, and do that vaccination. That's not right for everyone. You need to have a pretty big scale to be able to do this. There are times where you could host an event on site with a partner, right? You partner with one of your local hospitals or a local pharmacy, local health department, and they come to your work site, right? Because you don't necessarily have OC Health to do that vaccination, but you do it on site. So for example, for me as an employer, we have medical healthcare workers, right, that staff our hospitals and other residential. We used our occupational health arm. We allocated directly to them and did some of that vaccine. Other places that we just didn't have the scale for that, we did host an event for some of our workers. But honestly, for the rest who started to qualify because they were a very small group, were some frontline essential workers, we just didn't have the scale for that. And that's where I had employees get independently vaccinated. We certainly shared a lot of information about how and where to get vaccinated, but really asked them to seek that vaccination on their own. Now that we're opening up to more groups, we are thinking about what can we do in the triangle for some of our government workers here who are starting to be eligible in the coming weeks. So there's a variety of ways that employers could engage with this. I happen to engage in a number of this as an employer myself. And so using a lot of these different tools. What I would say is if you think you want to be on the more involved side with either going through occupational health or a vaccine, this is the time you should be already, if you haven't, gotten in touch with your local health department and raise your hand, and they can help facilitate. It might not be them doing the actual vaccination, but they may be able to pair you with others. So get in touch with your local health department and see what's available. There are some instances where we're going, like I said, directly to a campus. We're doing that for some of our schools in particular. We're doing that for a number of our meat packing plants. We're doing it from some of our agriculture settings. So there are a lot of different opportunities. But at the same time, if you're in the triangle, you're in the Charlotte area, there's also just a lot of places for folks to independently go get their vaccine. So I encourage folks to just make sure they're encouraging vaccine, reminding them of the fact that it is available, that they could be eligible, that it is safe and effective. All of those things are really going to be important to share. All right, with that, why don't I stop there, and I'd be happy to answer any more questions about what's going on in North Carolina, or to see if you have particular questions about how to engage in the vaccine process.
That's great. Thank you so much, Dr. Cohen. And that's exactly what one of Andy's most poignant points was about education, and the role of employers is really to help in facilitating familiarity with the process, comfort level with the outcomes, making it convenient for people, ensuring that you have a policy that says you're not going to be docked any pay when you go to get your vaccine, those kinds of things. A question has come in about the sites where vaccinations are available, and it seems like there's more limited access from a physician practice compared to maybe the Walgreens or going to. So can you give us some sense of, is that the strategy, and will that continue, or will you be able to at some point get more vaccines into the hands of primary care physicians?
Yeah, so the way we needed to start, some of this is a product of how we had to start the vaccination effort, right? When we go to the healthcare workers, we really needed to start with those that were working in hospital facilities. So they, as well as the health departments, were our very first that we worked on to make sure they were enrolled, they knew how to use the IT system, that they had their plans in place to vaccinate. And the other constraint for us is how this vaccine ships. They ship in large quantities. And so you have to be able to do a fair amount. And our expectation is, frankly, that if you get vaccine, you can give out all the vaccine you've gotten in 3 to 4 days. That is the speed at which our vaccine providers are working. So, for example, for you to accept any Pfizer vaccine, you have to agree to get out 1,100 vaccines in 3 to 4 days. That's a lot of work, right, for a primary care physician practice. I think that is changing because as we get more supply, we are certainly bringing on more providers. We have a ton of primary care providers. They tend to be larger practices, again, because they have the scale. So as we both have a larger number of people who can be eligible and more supply, that is exactly when we need primary care to sort of get in the game. And we want folks to get vaccinated in places that they trust, that are comfortable for them. So I'm a primary care doctor, so like I get it, but it was just a scale issue and a supply issue at the beginning, and so that really wasn't. And I will say for Walgreens, they actually get a separate allocation from the state. We don't actually allocate to them. Walgreens gets directly from the federal government. All Walgreens and some CVS's. So that is actually a separate program from us, which is it's great. More vaccine here in the state, but that's why maybe you're like, why are they first? Because it is a separate program.
Okay. Oh, that's helpful information. All right, so we've got a couple of questions that have come in from folks around people who've had COVID. Is there any special guidelines or advice that you would give, like in terms of vaccination for that population?
Yeah, so the recommendation is, even if you've had COVID, is to get vaccinated. And so that is what we were recommending to other, and the reason is because, one, vaccines help train your immune system. And in a very particular way. When you have COVID, it can vary how your immune system gets activated. And that way the vaccine sort of just covers you. You make sure you've gotten that baseline. So the recommendation is, whether or not you've had COVID, is to get the vaccine. Obviously, when you have COVID, there is some conferred immunity, meaning like you have some ability to fight off COVID in the future, which is great. Best to get the vaccine so you have even increased protection going forward.
Great. Gosh, I can't believe our time is almost up. One last question maybe. What do you think, or at least what have you seen companies do from an incentive perspective about getting the vaccine? I mean, that's one of the questions that we get asked a whole lot is mandate the vaccine versus incenting it. What are you doing, and what are the protocols that you've seen in place or that companies are considering?
Yeah, I mean, it's a great question, and I think it's the right conversation to be having, because, and I think that I think we should be focusing on carrots before we get to sticks, particularly in this moment. Frankly, I'm not the lawyer, but my understanding is that when you're in emergency use authorization status, that mandates are not something that can be considered at this moment. And so I've seen a lot of folks focus on the carrots, right? Whether it's certainly getting good information, making sure you can have time off, and not just time off to get the vaccine, but in case you do feel achy, particularly after the second shot. I'll say I got the Johnson & Johnson. That night, I felt, kind of achy. I took some Tylenol. I went to bed early. I didn't feel the best. Right? So just like giving folks a little grace for that, and that paid time off and recognition of that. But then I've seen gift cards, prizes, bonuses, extra, little incentive leave, like those kinds of things. You know best your employees and what works in terms of incentives. But my recommendation would be good information, appealing to the fact why this works, that it is safe and effective. And then sure, incentives are always, a nice thing for your employees to get. I would avoid mandates at this moment because, again, not the employment lawyer, but that feels a little bit murky, at least in the moment. I do think as we learn more about this, there are certainly going to be settings, right, that require and mandate flu vaccines, and I think we may be headed in that direction to go forward, but not, I don't think in the moment, particularly not everyone's even eligible right now. So let's at least get everyone eligible, then get them in, and then we can think about what we mandate.
Yeah, we keep answering that question of it's not really available for everybody to have a mandate, and is that really the best way to do it? I mean, there's way more opportunities, I think, to do just as you described, and certainly what Andy described as well in terms of encouragement, education, etc. So I want to be mindful of our time, and we are just at noon. Dr. Cohen, as always, thank you so very much for spending time with us this morning, giving us your insight and perspective. We all, I know, look forward to hearing from you when the press release comes out, but even more so to have that face-to-face with you is much appreciated. This year has certainly brought about challenges and struggles for all of us on a personal and a professional level. None of us could have been prepared for this. But your leadership has definitely helped us, and certainly Catapult as an organization, we are here for employers throughout the state of North Carolina and will continue to be. We will bring experts like Andy and Dr. Cohen, as well as the employer panel that we had. So please all stay tuned. I do encourage you, because we have our next wave of things happening from a legislative perspective. The American Rescue Plan is going to be talked about tomorrow morning at our answers at 8. So for those of you who are interested, tune in there. You'll hear from our own internal experts on what we should be thinking about for that. Dr. Cohen, again, I appreciate your time and everyone's participation. Everyone stay safe and have a great day.
Thanks, everyone.